Now to some good news, and Indigenous Victorians are leading the country with their uptake of COVID-19 vaccinations. More than 50% of the state's eligible Indigenous population have received one dose of the vaccine, and around 30% are fully vaccinated. Raylene Harradine is the CEO of the Bendigo District Aboriginal Cooperative, which has been administering Pfizer and AstraZeneca. She joins me now. Welcome to the program.
Thank you.
What do you put this success down to?
I think particularly for our area, we're the Bendigo District Aboriginal Cooperative, and the area that we cover is the Dja area. I think initially when COVID, 18 months ago kicked in, we as an organisation went into what we needed to do, particularly in keeping our community safe. And I think one of the key things we knew, because we know our community is, it's just how do we make sure that we keep everyone safe, but then what do we need to put in place to be able to mitigate the risk of anyone contracting, COVID.
And I gave you those numbers for the statewide vaccination for Indigenous people. What about in Bendigo? What sort of uptake of the vaccines are you seeing there?
Well, for our organisation, we've had up to date 694 vaccinations that we've provided over since we've commenced our COVID clinic and vaccination clinic, which equates to 76% over 60s fully vaccinated, and we've got 31% over at 18 to 16 that have received at least their first dose. So I think one of the key things when we first established the vaccine clinic, it was a little bit hesitancy around individuals wanting to sort of be vaccinated. However, I think just in terms of the staffing that we have at BDAC, it was ring around all of our, look at our priorities for our community, and just to let them know that this was happening, and also for them to be able to not just be influenced by us, but also to be referred to their GPs, to have that informed discussion around what is in the best interest of them as individuals, and then that would sort of roll out from there. And I think our communities are saying that this is getting worse, and so a lot of our community is actually coming through the doors now and wanting to partake and have their vaccine done. We do run a clinic on a Wednesday. That was the only day, but we're offering a Friday now as part of the increased demand that's occurring at the moment.
You just touched on the hesitancy there and how there seems to have been a really big shift in that. I wonder why you think that's happened, and where was that hesitancy coming from? Was that social media, things that were being said and done in the media? Do you have a sense of that?
I think it is. It's the mixed messages that's been, I suppose, promoted, and also I think what we hear on the news too, and over the last 18 months we've seen that you turn on the TV and the first thing is around COVID. It's how people interpret that too and what it means for them, but I think it's those mixed messages around making sure people do get vaccinated, but then you see the negative side of it as well. People go on to Facebook and those social media platforms and read various posts, and that can actually have a bit of a, I suppose people need to process that, but for them to be able to get to whatever their decision is. But sometimes there can be a lot of mixed messages around what's going on. And sometimes it's looking at, outside of our borders too, internationally, what's going on there, and just seeing that there are a lot of people that have died in other countries as a consequence of either there's no vaccination, but also the way that we practice, making sure that we wear masks. And that was one of the things that we did initially, was do a commercial last year, and it was around, and we used our own staff that community know around putting on, ensuring that you wear a mask, making sure you wash your hands and do all those safe things to keep, to just try not to expose our communities to what could be out there, but making sure that they keep themselves safe as well by doing all the right things and keeping social distance too. So I think that's worked for our community. But in saying that, there have been a downfall to that too, because a lot of our community we like to get together and socialise and do community gatherings, and that hasn't been able to occur over the last 18 months. So there can be there's the point around trying to keep our community safe, but then also how are they coping in the isolation as well?
Yeah, trying to find connections when that becomes even harder. What do you make of the news that we've been hearing throughout today of a COVID case in Shepparton, which is only, about an hour and a half away from you?
Well, that is very close. Melbourne's probably 2 hours, less than 2 hours from us, and that's very close as well. So it's really interesting because we have had the luxury of being open and to be able to, to do some activities compared to Melbourne. But then, what does that mean for our community here in Bendigo and where we are? But also, I don't know, because seems like the Delta can actually spread very easily. So it's like, what do we do in these circumstances? I suppose we just have to make sure that we do what we know is best for our community, because we don't want to see a death in our community because of the consequence of COVID. So it's a balancing act, but then it is about us being guided by what the health minister says and what government put in place. So we need to, do what we know is the right thing to do by not just our Aboriginal community, but the wider community as well, because, we're all in this together.
And look, just finally, what about the question of supply? How has that been for you with the two types of vaccines, and have you got supply going forward?
We have, we receive our supply from the federal government. So we've had a supply of AstraZeneca to date, and now we also have Pfizer. So, and we are getting supplies through to be able to run our clinic. And out of those supplies, none of them have gone to waste. We've utilised everything. So we're, making sure that and we have a really, our clinic is, won the RACGP award a couple of years back, our medical clinic, because of the way our doctors and our whole team work together. So, it's when we did register to become a vaccine clinic, we did it knowing that we have the capability to do this for our community. Even though that, in Bendigo in particular, we have other, Bendigo Health have got a clinic. They've got the super clinic. We've got chemists that are undertaking those sort of, providing vaccines. And the other sort of, there's Bendigo Community Health, there's the GPs are even doing it now. So I think in our community in particular, we do have Aboriginal people coming to our doors, but they do go to the other clinics as well within Bendigo, which is a really good thing. So, it's actually around choice for our community too. So whether they want to use an Aboriginal organisation or if they don't want to. So it's about choice.
It's so good to hear, and also that none of those vaccines are going to waste. Raylene Harradine from the Bendigo District Aboriginal Cooperative, thank you so much. Great to chat with you today.
That's right. Thank you.